morning, Oxnard Union High School District. My name is Dr. Tom McCoy, and I'm grateful to be your superintendent of schools. This morning, we're welcoming you back to school with some presentations from some guest speakers. And first, we'd love to introduce from our school board and the Board of Trustees of the Oxnard Union High School District are elected by the community to provide leadership and citizen oversight of our school district. The role of the school board is to ensure that the district is responsive to the values and priorities of the community and to provide each student what they need to be college ready and career prepared. Today, from our Board of Trustees, we're pleased to introduce to you Dr. Steve Hall, who's our board president. Dr. Hall was elected to the board in 2012. He holds a bachelor's degree in math, a master's degree in statistics, and a doctorate in organizational leadership. An educator for nearly 30 years, he has served in a variety of roles, including Dean of Math, Science, and Athletics at Oxnard College, President of the Ventura County Federation of College Teachers, and currently Dr. Hall serves as a math professor and math department chairperson at Oxnard College. Will you please join me in welcoming Dr. Steve Hall?
Thank you, Dr. McCoy. Good morning. On behalf of the Board of Trustees of the Oxnard Union High School District, I proudly welcome you back to another academic year. This year brings new challenges and new opportunities for you, our students, and their families. We are confident that each of you will continue to provide excellent support, service, and teaching with the goal of preparing every student for transfer and or to be career ready. Thank you in advance for all your contributions this year and your efforts in building powerful futures for every student of the Oxnard Union High School District. Good luck and have a great year.
Thank you, Dr. Hall. We'd also like to thank our other school board members, Vice President Beatriz Herrera, Ms. Karen Scher, Clerk of the Board, Mr. Wayne Edmonds, and Ms. Elizabeth Botello for all their support for all the things that we do here in Oxnard Union High School District. We're also this morning pleased to introduce our partners from the Oxnard Federation of Teachers and School Employees. And I'd like to welcome and introduce right now OFTSC President, Mr. Robert Caden.
Thank you, Dr. McCoy. Good morning and welcome back. Before looking ahead to the new school year, I want to thank all of you whose hard work and dedication made the educational process continue in the Oxnard Union High School District despite the tremendous hurdles that the coronavirus placed upon us. The food services workers who did not even get an opportunity for a break, as they worked from day one of the COVID outbreak to ensure that food was available to so many in our communities, many of which depend on these meals to get by. The skilled maintenance workers, custodian, and grounds crews who worked diligently to keep the schools open, clean, and sanitized for those who had to be on site. Those office staff members who kept the schools and the district office up and running so parents, teachers, students, and others would have the opportunities to get the needed services. Accounting and payroll, who while others were working remotely, had to come in to make sure that each and every one of you were paid on time. And of course, all the support personnel, the nurses, counselors, psychologists, speech therapists, paraprofessionals, IT professionals, bus drivers, all who provided much needed services to our students and staff. And to the teachers who had to completely change their methods of delivery so that the students could still get an educational experience through distance learning. For this and all of your hard work, I applaud each and every one of you. This year, we will again face new challenges, some of which we might have never expected. But I am confident that the men and women of this district, the men and women whom the union represents, all will once again rise up to the challenges that are thrown in front of us to ensure that the schools, education, and the services we provide to the community will continue. And I want to assure you that your union is here to support your efforts and to make sure you receive the respect and dignity that you have so deservedly earned. If ever you have a need, your union is only a click or a phone call away. I want to leave with this story that I'm sure most of you have heard, or many of you may have heard before, but I think it's apropos to say it now. A young girl was walking along a beach one day after a terrible storm washed thousands of starfish up onto the beach. As tide was rolling out, these starfish were just hours away from reaching their demise. As she came upon each starfish, she'd pick one up, toss it back into the ocean. Many people watched her with amusement. Finally, one man went up to her and said, "Young lady, why are you doing this? Look at this beach. It's covered with thousands of starfish. You can't make a difference. What difference can you possibly make?" This defeated the girl. She was flabbergasted. She didn't know what to say. But then finally she brightened and smiled, picked up the next starfish, and she came to and threw it deep into the ocean. And then she said to the man, "Well, I made a difference with that one." The man looked at her, thought of what she was doing, thought of what she said, and then he began to help her. And others watched, and others began to help, and the starfish was saved. While we may not be able to reach all of the students in our district, each and every one of us, through our encounters daily with parents, students, and the community, can and will make a difference. Again, I want to thank you, all of you, and have a safe and great school year. Thank you. Now back to Dr. McCoy.
Thanks, Bob, and
Okay.
thank you for that wonderful message. I'd also like to take a moment to thank our California School Employees Association president, Mr. Brian Heisengay, who could not be with us this morning, but I did want to take a minute to recognize and thank our campus supervisors, again, who were in person all of last year, doing a tremendous job helping us manage food service, guests and visitors, the check-in process last year. So thank you very much to Brian, the CSCA, and our campus supervisors for all your hard work on behalf of the students in our district. This morning, we're glad to have a representative from Ventura County Public Health, Aaron Slack, who's going to take us through the latest information on how to stay safe as possible in our return to school program. And thank you for being here, Aaron, and we'll throw it over to you.
Thank you so much, Dr. McCoy. As Dr. McCoy said, I'm from Ventura County Public Health. My name is Erin Slack, and I'm actually the maternal, child, and adolescent health epidemiologist here at Ventura County Public Health. And over the past year, I was not able to work as the MCH epidemiologist because most of my time was spent on COVID surveillance. So I've spent a lot of time working day in and day out on the pandemic, and one of the things that I definitely realized is that the only thing constant with COVID is change. So even as I'm sitting here today, I'm sure there's things that have been published that have kind of changed in terms of our COVID response, and I'll talk a little bit about that today, share a little bit of data with you, and also how we're aligning with the California Department of Public Health in terms of the guidance for the schools. So if you want to go to the next slide, which should be the surveillance data. So the slide that you're seeing, in addition to me, is on our COVID-19 case rate per 100,000 population. This is a single day case rate, and as I'm sure that you're aware, we have had a surge, most likely due to the Delta variant in our community, and the California Department of Public Health estimates that we sequence about 1% of all of our positive cases. And so, what we're seeing right now is predominantly the Delta variant, and we have seen a surge in our cases. But if you look over time, it's not anywhere near the surge that we experienced through December and January of last year. So you'll see on this graph that right now, we were leveling off for a while, and we're at a little bit of a peak, and we're hoping over the next few weeks to start to see a decline. We had some stable transmission over the last week or so, a little bit of an increase, but you'll see even our case rate is basically where we were at the end of February, which is the downturn of the previous surge. I will say that I unfortunately had the experience of reviewing all the death certificates for COVID-19 that come across our department. And at the same time in February, we would get maybe 20 to 35 death certificates reviewing a day. And now we're seeing about 1 to 2. So our vaccination rates in our community are really helping. Those that are high risk in the population have been vaccinated at high rates in our community. And so we're really seeing a decrease in the number of deaths that are coming in, even though the case rate is at a similar area. And then if you want to go to the next slide, you'll see also our hospitalizations are not anywhere near the point that we saw in January. I think our peak was a few weeks after the holiday in terms of the Christmas holiday and the New Year's holiday. In terms of hospitalizations, we had almost 500 people in the hospital with COVID-19, and we are seeing an increase now as a result of the increase in cases. The hospitalizations and deaths are both lagging indicators of COVID, but we aren't seeing anywhere near to what we saw during the last surge. And again, we're hoping to see a leveling off of our cases over the next few weeks, as what we've seen in other countries that have experienced an increased surge because of the Delta variant. So if you want to go to the next slide. So this slide talks about our breakthrough cases. With vaccines, they're not 100% effective. We knew this going into it, that even though people that were vaccinated, they still were at risk of getting infected, but the severe consequences, such as hospitalizations and deaths, are much less likely if you are vaccinated. So in Ventura County, we've had about 485,000 people that have been vaccinated as of last Wednesday. We put out our breakthrough cases every Wednesday. We get a list of cases from the state that meet the breakthrough criteria. A breakthrough case would be someone that's vaccinated, full vaccination status, so that'll be 2 weeks after receiving either the Moderna or Pfizer vaccine. The second dose of that, if you received the J&J vaccine, it'd be 2 weeks after the single dose administration. So far in our community, what we've seen is a little over 1,300 breakthrough cases. And of those, we've had 61 that have had to have been hospitalized and 9 deaths. Now, with the deaths, that doesn't necessarily mean that COVID-19 is going to be the final cause of death on their death certificate. It simply means that they had COVID-19 infection when they died, and COVID-19 is listed somewhere on the death certificate. And so if you're interested in our breakthrough cases, these are published once a week on VC Recovers. On Wednesdays, we get the list on Tuesday and then update the information in terms of the cases, hospitalizations, and deaths after that. We do, even despite the fact that we are seeing infections in our vaccinated population, we still believe that vaccination is the #1 way for us to get through this pandemic, and we're still encouraging vaccination in all age groups that are currently eligible for vaccination, unless you have a contraindication, which I'll talk about later on in the presentation. So the next slide, I kind of can't get to it on my screen. Next slide. I'm going to talk about the CD. You can actually just go ahead to the next one. So I'm going to provide updates. Ventura County Public Health is completely aligning with the California Department of Public Health in terms of their school guidance for K through 12. There are 2 caveats to that, though. We have a lower temperature threshold. So the California Department of Public Health has a temperature threshold of 100.5 degrees. We have always, Dr. Levin feels that the 99.5 should be the threshold through the temperature threshold. So we've always had that as our temperature threshold. And then when we're talking about modified quarantine for those that have had a positive contact with a positive COVID-19 case, we also are doing a modified version of that. The state allows for a 7-day modified quarantine, and we're going to stick with the 10-day, but I'll go into more detail about that. So if you want to go to the next slide. So masks are required for all students and school staff, and for staff, it's when students are present. This is where this has changed a little bit, even since I sent the slides along to Dr. McCoy. On Friday, Dr. Levin put out a health order that required masking of all individuals regardless of vaccination status indoors. And so for those staff members that normally would take off their mask because they're vaccinated, in administration when students aren't present, or during staff meetings when students aren't present, that's no longer allowable. The health order goes into effect today at midnight. All businesses have to comply by today at midnight. It expires on September 19th if we don't roll the order over for additional time. We're hoping that, as I said before, we're starting to see a little bit of a leveling off of cases, and we're hoping to see a decline, and then to not have to reinstate that order after September 19th if we feel that the case rate is in a place that is on the decline and we're not seeing a stable or standard increase. So the reason that universal masking is very much one of the only required things of the California Department of Public Health is because it works. We saw last year, even in Ventura County, as many school districts had gone and returned to in-person instruction, either in a hybrid or full in-person learning model, most of the outbreaks that we had were not in classroom transmission. We did have several outbreaks and still continue to see outbreaks for extracurricular activities in terms of athletics, but there was minimal classroom to classroom transmission within classroom transmission. And so we know that masking works in the school environment. And that's why it's so important that of all the things that we really need to monitor and make sure that staff and students are complying with the masking to ensure that we don't see outbreaks within our schools. Now, I will say that the California Department of Public Health is also going to reevaluate. In November, they're going to be looking at the case rate and hospitalizations and deaths and see if they can reevaluate the masking in terms of the school transmission. And so they expect to look at that again on November 12th. But right now, universal masking is required. There are some exemptions that may apply. It actually has to be through a medical provider that allows for those exemptions to go forward. And even those that are exempted from wearing the normal face coverings would have to wear a face shield with a drape, so they're not exempt from wearing anything at all. If you want more information about the exemptions, we do have that online. In terms of physical distancing, I know last year we learned the new kind of social distancing as one of our new terms that probably no one ever wants to hear about again. And in the classroom, it went from 6 feet and then down to 3 feet, and now there is no minimum distance required. And part of the reason there is no minimum distance required in the classroom is because of the universal masking in place. We do know that primarily COVID is transmitted through aerosols and not droplets, and droplet is really where we want the physical distancing to be in place, and so that's why the masking is very important to ensure that we have low transmission in the school environment. And then the next slide, please. Sure if I can get to the next one. So the next one is about our quarantine. Now that we do have vaccinated individuals, both in the classroom and in the school environment, there's new guidelines for quarantine. Previously, if you were a contact of a confirmed case, the student would have to refrain from coming back for in-person instruction. Now, if both the case themselves and the contact were both wearing a mask, as they should be in the school environment, then the person that was a contact of the confirmed case can actually continue to go for in-person instruction. They have to refrain from extracurricular activities and club sports, but they're allowed to continue to have in-person instruction. And this, we feel, is a great benefit to our students. We really don't want to see full classrooms having to go to distance learning. We want everybody to have the fullest extent possible of in-person learning because we know that that's the best for our kids, and it's better for our teachers to establish that rapport with the students as well. And so for vaccinated students, they only have to quarantine if they are symptomatic. If they become symptomatic, they will have to go through the quarantine process and get a negative COVID test. If you're unvaccinated and you're masked, you are allowed to continue with in-person instruction. You will need to go through a testing twice during that time period, and it is a 10-day quarantine with monitoring symptoms up to that 14-day period. If you are unvaccinated and you were unmasked, or the person that is the positive case was unmasked during your exposure, then you will still have to go through the formal quarantine process. But we're hoping to really eliminate a lot of the kids not being able to be eligible for the in-person instruction through this modified quarantine. Now, the state guidance does say that the modified quarantine that allows the return to in-person instruction can end after 7 days. Dr. Levin wants that quarantine to continue for 10 days. So that is the two things where we kind kind of misalign with the CDPH guidance would be the modified quarantine. We go till 10 days, and then also the temperature threshold. So the next slide should be, I believe, can I confirm that it's on the decision tree?
It's contact tracing.
Okay, so for contact tracing, we have our school liaisons that are doing our contact tracing in conjunction with the VCPH liaisons, and we really appreciate all the efforts that you're doing in terms of contact tracing. And this is also a change since I put through the slides. We are asking that schools continue with their contact tracing efforts. However, all positive cases need to be reported into SPOT. If you're a Ventura County Public Health liaison with Ventura County, a school liaison with Ventura County Public Health, then you'll be familiar with the outbreak reporting in terms of the positive cases and the contacts. Now we have modified our reporting requirements for the contacts in that the school liaisons will have to follow them on their own, and they don't have to report them into SPOT during this current surge. So temporarily, we're only requiring positive cases to be reported in SPOT. And when a contact then turns to a positive case, they need to be reported, but we're trying to kind of alleviate some of the burden on the schools in terms of the contact tracing. So if you want to go to the next slide. So this should be our student symptom decision tree, and this goes over a lot of what I talked about today. I have a copy of it here as well. It's available on vcrecovers.org, and this kind of walks you through the process. So if you're a contact of a confirmed case, or you vaccinated versus unvaccinated, it really helps the school liaisons decide whether or not a modified quarantine is appropriate or if a full quarantine is required for those students or staff members. Now, staff members have to follow Cal OSHA guidelines. It's a little bit different for students than it is for staff, and that is also delineated on the student decision tree, but it is available online at vcrecovers.org under school information. So I think my last slide is next, and that should be on vaccines. As I said previously, we are really encouraging everybody 12 and older to ensure that they get vaccinated. We have over 73 different facilities and pharmacies in Ventura County where you can walk up and get free vaccine. I was just at Target yesterday. I saw several people going and taking advantage of the free COVID vaccine that we have available. There are some contraindications if you have an allergic reaction to some of the chemicals that are included in the vaccine. That would be a contraindication, or if you had a previous response to vaccination with one of the COVID-19 vaccines. For all others, if you feel that you have a contraindication to the vaccine, it's best that you talk to a medical provider and talk through that with you, but we really are encouraging the collaboration with the schools. We've been working with the school districts, including your school district, to have on-site vaccine clinics for the community and both students and staff to encourage high rates of vaccination. I do believe that because of our high rates of vaccination that we have here in Ventura County, the current surge that we're experiencing with the Delta variant is not as high as it would be if otherwise we had lower vaccination rates in our community. And we will continue to support the school districts in terms of their return to in-person instruction. Last year, I know most of the presentations that we gave were really trying to encourage everyone to go back to full-time and to go back to in-person instruction in a hybrid capacity at that point because of the physical distancing. But we are very excited about the return to 5 days a week in-person instruction for all students in our community. We saw educational inequities in our community in terms of the private schools being able to return to 5 days a week in-person instruction last year through the waiver program, and that not being available to all of our students within our community. And we do believe that the school environment is a safe environment if the recommendations of the California Department of Public Health and Ventura County Public Health are followed, especially in terms of the universal masking for all students, staff, and faculty. And with that, I will turn it over to Dr. McCoy, and I thank you for your time today.
Thank you very much, Aaron, and I just wanted to take a minute to say thank you to all the folks on the team at Public Health. We've been meeting weekly over the summer through the Ventura County Office of Education and with all the local district superintendents and public health, and that's been weekly. We'll continue to do that, and what we've seen, as Aaron mentioned, is over time we know things change, and so as soon as we have updated information, we receive that in real time from public health, and we'll make sure that's out to all of you, our staff and employees, so that we can best serve our students. We have a couple of other things going on this morning. One is I just wanted to take a minute to introduce Rob Vandermay. Rob's a longtime teacher with us who's now at Condor High School, and came to me with an idea about 2, 3, 4 weeks ago about entering our district into the corporate games, which would be an opportunity for us to do something together as a team. And we're going to throw it over to Rob right now with a little more information about that and how to participate.
Good morning, OUHSD colleagues. Remember March 13th, 2020? Yeah, that's right. Friday the 13th. In some ways, for me, it's like it's yesterday. In some ways, it's like it's 10 years ago. A national emergency was declared, canceling, among other things, the professional development day that was scheduled for the following Monday. It was keeping us apart and isolated for most of the last year and a half. Well, today's professional development brings us a little renewed sense of cautious optimism. As we are beginning to recover from that shutdown mentally, emotionally, and physically, Dr. McCoy has graciously agreed with my proposal that we could use a unique opportunity to help bring us back together as a district, as schools, and all employees, and that opportunity is the Ventura Corporate Games. These games have been going on for over 30 years. They've included such entities as Amgen, the Naval Base, Cal State Channel Islands, Ventura and Thousand Oaks government offices, Trader Joe's, Patagonia, Community Memorial Hospital, and Ventura College. There's something in it for everyone. There's a lot of athletic competitions, everything from a 5K run to axe throwing, from beach volleyball to bowling, billiards to paintball, cornhole to surfing, flag football to miniature golf, full-size 18-hole golf, softball, paintball, pickleball, soccer, and even kickball. Do you like mysteries and mental challenges? Well, there's a virtual escape room you can be part of. There's also team unity competitions. There's a community service project that you could get involved with, photo contests, sand sculpture building contests, t-shirt design contests, among other things. Just think, you'll see Tritons and Yellow Jackets working together, Raiders and Vikings side by side, Spartans and Scorpions fighting for a common goal, Condors, Rockets, and Monarchs all linked together. You'll have Adult Ed and Oxnard Middle College joining forces, certificated and classified employees playing as teammates, even district office personnel and union representatives united in competition. Look for an email today or tomorrow from Dr. McCoy that'll have a survey in it for you to list anything that you'd like to participate in. We hope you'll take advantage of this opportunity to come together as a district, to bond with colleagues, and hopefully kick some corporate butt. Thanks, Dr. McCoy.
All right, thanks, Rob, and I just want to give Rob a big shout out of appreciation for spending quite a bit of time putting this all together, and we'll get more information out to you in terms of how to participate. We think we're going to need, as Rob let me know, maybe 300 to 400 different people to get involved with us, so we really hope you will come forward and participate. Before we go, I just want to share a couple things with you. One, I just want to tell you how much I appreciate your work and service on behalf of our students. Our work is always important, but it is never more critical than it is now. We learned through the pandemic that the impact of poverty on our students and communities is real, and that our institutions and our work stand in front of students and their ability to access a powerful future. We're here to provide support, professional learning, and whatever is necessary to make our students successful. We're here to promote a safe environment as we move through this COVID pandemic. We are going to be supporting the wearing of masks and all the other public health orders that come to us. But the most important thing is if we believe in our students and our community, they'll believe in us, and together we'll see it through. Thank you, and have a great school year.